Hi, so this is Dr. Zadeh, and I think based on what we are hearing on the news from the scientists and authorities, uh, it's clear that this virus is not going to go anywhere. And even if it temporarily becomes less prevalent, it may come back in cycles. And unfortunately, as dentists, we are most vulnerable for this. Because remember, this thing stays in the back of the throat and in the mouth. And if you've noticed, when they want to conduct a test, they take swabs of the cheeks and lips. And if the virus is enough loaded on the cheek and lips to give response to the test, it's plenty enough for it to be splattered when we are working in the mouth. I was also told in ICU they consider intubation as a high-risk procedure. Now, what is an intubation? Intubation, the doctor is close to the patient for less than a minute, and they just insert a tube in there. Or, okay, take out the tube and insert it back in. But we as dentists, we are not only that close to the patient, but we're going to be sitting there for 1 hour, sometimes 2 hours. And worse than anything else, we're going to be spraying air and water into a closed cavity, which is the oral cavity. And then on top of it, we agitate all of this mix at 200 to 400,000 cycles by running our burr on the teeth. So guys, this is serious. I mean, if there is a virus in our patient's mouth, there is no way we don't spread it all around. Now, the question is, how far does it spread, and how can we protect ourselves? You may say, oh, we're going to wear N95 mask. Okay, N95 mask, what is it going to do? It's going to cover our mouth and nose. And yes, we will not inhale the virus and the aerosol with the N95. But with so much of the splatter all over, it's going to definitely go on our head, on our forehead, on the side of our face, on the straps of the mask, right over, our chest. So if this virus is the type that they say will last for hours and days on inanimate objects, then we're going to be all covered with the virus. And as we're working, it's going to splatter. So we need to find a way to, first of all, find out for sure. I mean, I don't want to create unnecessary fear among the profession either. So we need to find out really if that patient is sick. Oh, another point we need to consider is that unlike SARS, Ebola, MARS, all of these diseases that were infective only when the patients were symptomatic, this disease is infective even when the patients are not symptomatic. Some patients may not even know that they have it because they have subclinical symptoms or no symptoms at all, and still they could be giving out the infection. So for that reason, for the foreseeable future, I think there is always a chance that we have somebody in our chair that is carrying the infection. Now, one thing is going to change it if we have tests that we can administer in the office with the results coming back in 5-10 minutes. I've heard there are 5-minute tests. Now, how reliable they are, how accessible they are to the dental office, I have no idea. But if it becomes something that, like a little credit card machine, we can get, put it on the counter, and everyone who walks in, say, I don't know, swab or spit or breathe or do something to this strip, and then go sit there for 5 minutes. And after 5 minutes, if the test became negative, then sure, we can bring them back and work on them just like we did in the good old days. But I don't see that in the near horizon. So until that becomes a reality, then we should imagine that every patient that sits in front of us in our chair could be carrying the infection. So how do we control ourselves? Now, yes, we can wear an N95 mask. Now, N95 mask, as I said, will protect us from inhaling it. And if we are sick and we don't know anything about it, it will 100% protect the patient, because whatever comes out of our mouth has to go through the mask. But it's not going to cover us against the splatter from the patient's mouth. So we're going to conduct an experiment to see how far that splatter goes, and we're going to see how we can keep that splatter away from ourselves and with peace of mind, so that we can treat our patients. Another part of the experiment is to see if these get carried over with the air conditioning systems. In a multi-unit offices, somebody can be sick in next door and could be coughing all the viruses in the air, and the return air brings it and pushes it into our space. And if this is a virus that can survive in droplets, and the droplets don't get stopped by the filtration systems, then we are prone to getting sick from the air conditioning. It's less of a worry now because most of the buildings are more than half empty, but imagine if everything gets to full swing and all the offices are full to the capacity, they're bound to be one or two sick people, and we need to make sure that that's not a route of transmission, at least in our office. For this, I have ordered special MARV 16 filters. They're actually MARV 14, which I'm going to be modifying it to MARV 16. And all the inlets in the office going to be covered with this MARV 16 filters. Also, we have a additional air conditioning system in the office that circulates the air within our plenum space, and I'm going to be equipping those also with the MARV 16 filter, so that we can keep that system on all the time to further filter the office. Now, as far as the assistant and myself are concerned, I've ordered some hoods, positive air pressure hoods, that my assistant and I will be wearing, with a special pump with 20 feet hoses. So we're going to be putting the pump in the hallway, and of course we make sure no one stands on top of the pump. But even if they do, there is a HEPA filter that I have retrofitted the pumps with, and through those hoses the clean air comes to the back of our head and gets flown over our face. I've done this learning from our controlled room that we have for cleaning our implant parts. So this is gonna be called controlled environment dentistry. Why? Because we are controlling the air that's around us. Doesn't matter what's in front of us, around us is controlled environment. Now, this is in addition to the regular PPE that we are wearing to prevent blood-borne pathogen contamination. So we still have to wear the gloves. One thing that was not part of our PPE, at least in a general dentist's office, which now I think is very important and should be, are these gowns. Now, these gowns, I think they were made for the opening to be in the front, but what I recommend is for us to wear it with the opening in the back and then close it. These gowns are long enough that would cover our pants, and we'll see if the experiment shows that the splatter goes even on our shoes and our back, then we'll have to go to a full hazmat suit. I don't know. That's what the experiment is for, and we're going to find that out and let everyone know how best dentists and the team can protect themselves against this virus. Stay tuned.